Okay, welcome everybody to the PEAS Provider Training Overview and New Tools. Thank you for attending this afternoon. I'm Justine Turner. I'm a paediatric gastroenterologist at Stollery Children's Hospital, and I'm the medical lead for the Pediatric Enteral Nutrition Program here. There are going to be other project team members presenting during different parts of this presentation, and they'll introduce themselves at the time. This presentation is being recorded in video format by Alberta Health Services. The recording may be used and disclosed by AHS for educational purposes and may be for the further broadcast for other presentations, publications or promotions. That might include conversion to digital format, storing and publication on webcasting technology. The focus of today's session is going to be to give you an overview of the new resources and tools available for healthcare providers, which are included in the new PEAS website, access and navigation, equipment and supplies, and standardized practice and education resources. So next slide. So a couple of housekeeping items. If you have comments during the presentation, we would be really grateful if you could write them in the chat box and select all panelists and attendees so that your comments can be publicly visible. We will also have time for dialogue and questions at the end of the sessions, and you can use the Q&A or raise your hand feature to ask any questions you might have. Okay, next slide. So the Pediatric Eating and Swallowing, or PEAS project, is a provincial quality improvement initiative with the purpose of developing a clinical pathway to standardise and improve the care of children with a paediatric feeding disorder, as defined by Praveen Godde, co-authors in JPGN in 2019. For this phase of the project, our target population is children in ambulatory care, so we focused our resources on outpatient and community care, but many of them can also be applied and adapted to other care settings such as acute care as well. So the definition of pediatric feeding disorder is a disturbance in intake of oral nutrients inappropriate for age, lasting at 2 weeks and associated with one or more of the following. So medical dysfunction such as cardiorespiratory compromise during oral feeding, aspiration or recurrent pneumonitis. Nutritional dysfunction as evidenced by malnutrition, specific nutrient deficiencies, or decreased diet diversity, or reliance on enteral nutrition support or oral supplements to sustain nutrition and hydration. Feeding skills dysfunction as evidenced by a need for texture modification, use of modified feeding position or equipment, or use of modified feeding strategies. And last but not least, psychosocial dysfunction as evidenced by active or passive avoidance behaviours from the child when feeding, difficulties for the parent in management of the child's feeding, or disruption of social feeding or the parent-child relationship. And finally, this is in the absence of cognitive processes consistent with an eating disorder or a pattern of eating or feeding intake that is congruent with cultural norms for that child and family. And it's very important to note that this definition has now been recognised and afforded an ICD-10 code in the United States, and we're hopeful to adapt that ICD-10 code and that it might come in the Canadian ICD codes. So this project is actually supported by grant funding from MINT-Cs. We want to acknowledge that, and that funding is from 2019 to 2022. Next slide. The project was actually inspired by leadership from Alberta Children's Hospital, the Glenrose and Stollery. The leaders in these care settings recognised that there was a need for quality improvement in this area. And the project itself actually started with 2 World Cafes that were conducted in northern and southern Alberta, with the goal of determining from multiple different stakeholders that included patients, families, dietitians, nurses, pharmacists, social workers, administrators and others who could tell us what they felt was currently working and was not working in the care of children with feeding difficulties. So this slide just shows you a sample of feedback that we got from the World Cafes in late 2018. These were issues that concern the families and the care providers who were participating, and they center around things like communication, role clarity, accessing services, gaps in knowledge, goal setting, and being patient and family centered. So in line with those types of concerns, you can see that there were major themes that we were able to identify from the World Cafe. And it's very interesting that these themes were similar in their frequency across the entire province, regardless of whether you were north or south, or regardless of whether you were in an urban or rural setting. Next slide. So using the World Cafe feedback, we applied the theoretical domains framework to develop implementation strategies to address major barriers of access and navigation, standardized practice and education, equipment and supplies, roles and implementation. And importantly, because this is a quality improvement project, we included evaluation and feedback. And then we're going to develop evidence-based processes for dealing with each of those domains. So we have been providing training already with summer sessions that were very successful and have been posted online. And going forward, we'll be looking at the CPGs and collaborative practice and roles, supports, and these will also be available through the PEAS website. So we'll be hosting a repeat series this fall, and we really hope that you'll be able to take these other sessions as well. You'll be able to find recordings of the sessions on our website under courses and webinars for health providers. And at the end of today's session, if you'd like a certificate for attendance, please email us at peasproject@ahs.ca, as shown there.
Sorry, I'm just fiddling with my mute button here. Hi, I'm Vanessa Steinke, and I am the Provincial Project Manager for the PEAS project. And I just have the pleasure of walking you through some parts of the website. We will delve into them in greater detail, but I'll just take you through a quick tour of it. So the PEAS website can be found at peas.ahs.ca. And I'll just show you the live website right now. So we've really tried to design the PEAS website to be very family friendly and to make information as transparent and as accessible as we can to both families as well as healthcare providers. And you can see that many of the sections of the website are targeted to both sets, either family and or healthcare providers. So we have some popular resources here and the quick links here, and there'll be a number of tools that we're showcasing later today in our presentation. And then also on the homepage, just in this blue bar, just because there's so much information on our website, we wanted to try to help people navigate to where they might be wanting to go quickly with some common questions. And so for healthcare providers, for families, you can click on any of these and they'll take you to some more information about those topics. And then I'll just mention the navigation bar here on the top. As I mentioned, we'll dive into some of them further, but I'll just click on a few for you as we won't be going into all of them. The first one I'll just show you is Feeding a Struggle. That's our screening tool, and it will take us to another website that Bev will mention later for screening. As well, the FAQs on the top here, you can click to. There's some neat functionality in here. So you're able to add these FAQs to a list and then email it to yourself. Well, that's a very long one. You can email it to yourself or email it to another healthcare provider, to a family, and send those relevant questions to them. And I also just wanted to quickly show here the search feature is actually pretty powerful. As I mentioned, there's a lot of information on our website. So I'll just type in goals and show you a little bit more of the search feature. So it basically returns anything that has the search term in it, and we'll show you what page it's on, whether it's on a web page, or if it is part of one of our the guideline, as well if it's part of an FAQ. So I just encourage you to explore the website and the different features. I'll just also point out on the footer, there's ways to contact us or join our community of practice, a link here on how to order any forms or handouts if you want them in bulk, and then how to access the family survey that we'll talk about later. And the last thing I just wanted to show you quickly was on every page, we have some quick links on the left. So there's just the regular menu here, but we also have tried to add in some quick links that change depending on where you are in the website with some popular locations that might be of interest to you if you're in there. I'll just go back to the slides. So we're also we're also really excited that the website is mobile responsive, and you're welcome to share it with families as well that way. I'll just turn it over to Naomi.
Hi, everyone. I'm Naomi Beswick. I'm one of the what was our title? I don't remember. Sorry. I'm one of the people that was like the lead on the Access and Navigation Working Group. And I just wanted to share some of the things we worked on as our group today. So one of the first things we worked on, the overarching goals of the Access and Navigation Working Group had been to explore means of ensuring sustainable, equal access to eating, feeding, and swallowing services across the province, and also to facilitate the ease of navigating these services. So this working group actually started by kind of outlining how and where the services were already happening through process maps. We also looked at where the services were found and how they were found, and navigated by working with teams throughout the province to update the Alberta Referral Directory profiles to a consistent template, and by creating resources for families exploring private options. And our working group completed a workforce and wait time analysis to better understand the provincial current state of eating, feeding, and swallowing services. We piloted virtual health options, and we created documents for standardized services, as well as referral and triage criteria to facilitate consistent access to care. And we'll just talk about all of these deliverables in a little more detail, and all of this information and more can be found on the PEAS website. And you can find, this is the page to show us, on the PEAS website, you can find all of these resources under this Find Services heading and using the sub-menu on the left. So this is one of the maps that we created because navigation was a key component of this working group. So our working group initially drafted this flow sheet to demonstrate what a typical workflow would look like for any referral. And this highlighted some of our overarching principles and values and laid a foundation for much of the other work that we pursued. We also worked with each of the zones to lay out flow maps for each area of the province to help clinicians know how to navigate eating, feeding, and swallowing referrals. These maps are also all on the website and may be helpful to clinicians seeking to navigate how to access service in different areas of the province. So on the website, the workflow maps can be found under the column on the left. Another way of navigating services that we worked to create was a central listing of services in the province, and we anticipate that this will be a navigation tool that families will also find useful. And you can see this in the center column on the website here. So Vanessa's just going to show us. Finding services within AHS can be challenging with each program having a different name across the province. So we've worked together with various clinics and services involved with eating, feeding, and swallowing to compile a list within each zone, such as what is shown here in the Edmonton zone. This list contains links to the Alberta Referral Directory, as well as to other searchable Alberta Health Services directories of care, and also contains locations of service organized by the zone. So after working through available literature and data, we were also able to determine some wait time targets, some typical referral criteria, and a template to help organize entries in the Alberta Referral Directory. We worked with the Alberta Referral Directory team to align Alberta Referral Directory entries across the province to include some of this consistent information. As an AHS-supported, externally available, searchable directory for the province, it was felt that utilizing the Alberta Referral Directory was the best way to ensure and to maintain easy access referral directory information, The Alberta Referral Directory was then team was able to enter consistent search terms and information in the back end of the Alberta Referral Directory profiles to ensure that families and clinicians alike could easily find the eating, feeding, and swallowing referral information that they need from across the province. You can also find information like the access and referral targets right on the PEAS website. For families, we also created a document outlining questions to ask and where to look if pursuing private practitioners. This information can also be found on the new website under Other Providers and Services and includes links to various organizations where private clinicians might advertise or register their services. One of the more exciting projects that the Access and Navigation Working Group supported was a pilot to trial the use of virtual technologies for eating, feeding, and swallowing services. Across the province, 3 sites participated in using virtual health for follow-up appointments. Feedback from families and clinicians alike was overwhelmingly positive, and information and tools designed to support additional sites in implementing virtual health for feeding appointments can also be found on the PEAS website. And I can say one upside of COVID has been the access to Zoom, and we are now routinely doing those kinds of appointments through virtual health here at the Glenrose, and I think across the province. Finally, the Access and Navigation Working Group also completed a workforce analysis, interviewing managers across the province to better understand service delivery. With this information, we are not only able to understand where the service happens, but what that service looks like, who's providing it, what the demand for the service is, and what resources we have in the province to provide eating, feeding, and swallowing services. This information informed the creation of a standardized services recommendations document outlining the basic expectations of what service delivery in the province should consist of. These tools can inform managers and team leads in program development and advocacy activities.
Welcome to Standardized Practice in Education. My name is Beverly Collison. Together with Melissa LaChapelle, the AHS Provincial Practice Lead for Nutrition Services, we have the pleasure of co-chairing the Standardized Practice and Education Working Group. Over the next few minutes, we will highlight some of the supports developed by our working group for health professionals and for families. Before we do, we acknowledge the very many health professionals from across the province who devoted as many hours developing and polishing all of the supports that you will see today so that they would be PEAS perfect. We are really excited to start by sharing the PEAS Pediatric Feeding Disorder Clinical Practice Guide. The Clinical Practice Guide aims to provide evidence-based clinical guidance to enhance pediatric safety and quality of life. These are pivotal to quality improvement in a field that has clinical and ethical complexity and where very few guides and standards exist nationally and internationally. This guide provides information, guidance, and recommendations to support health professionals in making clinical decisions about screening, assessment, and management of children diagnosed with pediatric feeding disorder. At its foundation, it is meant to facilitate communication and collaboration amongst health professionals and with families by using consistent language, definitions, and strategies. Assist healthcare professionals collaborate with families and offer clinicians tips, tools, and training resources to support lifelong learning and education. Here's how to find the Clinical Practice Guide on the PEAS website that Vanessa showed us earlier. On the navigation bar at the top of the screen, click on For Providers. It will take you to the Clinical Practice Guide. Click on Read More. Here you can download it. Note the sidebar. This tool is the CPG Quick Reference. Click here and you will find many figures and tables spanning information from screening through assessment, diagnosis, management, monitoring, and transition. To learn more about how the Clinical Practice Guide provides practice standards, please sign up for the Pediatric Feeding Disorder Clinical Practice Guide virtual training session offered next Wednesday, October 28th. We hope to see you there. Back in 2019, PEAS inventoried clinical information systems for tools and forms specific to feeding, eating, or swallowing currently in use across the province. The AHS data group sent PEAS all relevant forms available provincially, of which there were over 100. Of these, were a screening tool, a food record, a collaborative goal wheel, an oral feeding care plan, and an enteral feeding care plan. From all forms received, the Standardized Practice and Education Working Group prioritized these 5 for further review and development. Part of the prioritization work included consideration of the implementation of Connect Care work across the province. Recognizing that the many possible tools and forms to support pediatric feeding disorder are not currently available in Connect Care, and that we will have some sites across the province that will not be on Connect Care until the fall of 2022, these forms are available on the PEAS website. Melissa LaChapelle will share how to access these forms shortly. Let's take a look at the 5 prioritized forms. A screening tool. The Feeding Matters Infant and Child Feeding Questionnaire is a remarkable online tool available for both families and healthcare providers that leads families and health professionals through a series of questions that use smart logic to arrive at a risk statement for pediatric feeding disorder. Importantly, as families and health providers work through the questions, each provides education about typical and atypical feeding and eating development. This questionnaire serves a robust platform for families to start conversations with their child's care providers, such as their family physician. After completing the Feeding Matters Infant and Child Feeding Questionnaire, families can return to the PEAS website and click on Find Services to locate services in Alberta. And hot off the press, a subset of authors of this screening tool just published an article in the Journal of Pediatrics describing the psychometric properties of the infant and child feeding questionnaire. You can find it on the PEAS Community of Practice section of the PEAS website, which Melissa will be describing shortly. A food record. A food record gives insight into a child's daily food and drink intake, diet variety, the family routine, and feeding environment. Providing families and caregivers with the food record in preparation for their visit with the registered dietitian and their healthcare team can facilitate conversations and build rapport during the clinical visit. The collaborative goal wheel. This is a duplicate form that allows the family and healthcare provider an opportunity to co-create goals, document them, and then each keep a copy of this record. Collaborative goal setting provides a means by which to plan ahead, provide direction, and establish a clear, mutually understood trajectory of the child's management or treatment plan between the health professional and parent or caregiver and across the interprofessional team. Parents, and if possible, child's participation in development of the child's own meaningful goals and treatment plan provides confidence to the family that their treatment team is working in a coordinated fashion to help them work towards goals that are important to them. Consistency, that is commitment, to one plan across the team and parent or caregiver will improve their child's outcomes. This particular tool has been carefully aligned with the existing suite of Connect Care collaborative goal-setting tools. The oral feeding care plan. A clearly defined feeding care plan is an important part of successfully managing a pediatric feeding disorder. It is an essential part of communicating and implementing safe and successful strategies across multiple care settings, such as perhaps grandparents' home, the daycare, and school. An oral feeding care plan is also a useful means to document interventions that may also require care and attention, such as those related to aspiration risk or allergies. Similarly, an enteral feeding care plan serves the same function as the oral feeding care plan that we just reviewed. Presently, the Standardized Practice and Education Working Group and Nutrition and Food Services are working through the many processes involved in developing a PEAS provincial form. Coming to you soon. I will now turn it over to Melissa, who will guide us through the family education materials developed by the Standardized Practice and Education Working Group.
Thanks, Beverly. As part of the project deliverables, the Standardized Practice and Education Working Group was tasked with creating an inventory of family education materials to identify resources to adopt, adapt, or create. The goal was to have an inventory of materials that supports consistent PEAS messaging, resource access, and education delivery. A large number of resources were collected and reviewed from Data Group and MyHealth Alberta, and our working group canvassed their colleagues and sent us additional materials that may be in use across the province. We then reviewed each resource for content alignment with the CPG and identified which resources we could adopt, those that required adaptation, and areas of the CPG where there were no resources. We adopted over 30 resources, many of which are from nutrition services, and these are posted on the PEAS website to support family education in the areas of dysphagia, texture-modified diets, feeding skill development, nutrition, oral health, autism spectrum disorder, and equipment and supplies. Where we identified the need to adapt or create a resource, the working group prioritized our top needs, and we've been working through these the past few months, as I'll share on the next few slides. Additional resources for families have also been included, such as books and websites, and mental health resources are also available in the family life and self-care section of the website. On the website, families and clinicians can access the family education materials under the For Families tab, and then visit the left-hand toolbar for oral feeding related resources. We have adapted and created several new family education materials that our group is really excited about. Gagging in babies and children is intended to be used by clinicians to support families who may be concerned about their child's gagging and need guidance on when to be concerned and when to seek additional assistance from a healthcare team member. Often babies are recommended to feed in a sideline position, either at hospital discharge or in the community. Our new handout will support parents to understand when to do this, have a visual on proper positioning, and to offer guidance on when they can consider transitioning to a more traditional cradle hold. Although Healthy Parents, Healthy Children offers information on feeding cues, our team felt the need to have a more targeted resource available on our website with a feeding-focused lens. Your Baby's First Tastes and Introducing New Foods to Your Child handouts were born out of a need to support families where the introduction of food may not follow a typical introduction timeline. These are intended to support infants and children with a pediatric feeding disorder where the steps to introduction may require a gentler and more graduated approach. More recently, we have adopted a video to reflect normal swallowing. As additional family education needs are identified, this work will continue to evolve. We are in the process of finalizing our new Thick Fluids Pediatrics handout. Our working group has also contributed to the Nutrition Services review of their texture modified handouts. We recently adapted a handout on aspiration risk from the Holland Bloorview Kids Rehabilitation Hospital, which will be posted very soon. And at this time, my colleague Beverly is leading discussions about resources related to infant pacing. The Standardized Practice and Education Working Group has liaised with and provided oversight to materials developed by the other working groups to ensure consistency and alignment with the Clinical Practice Guide. Processes for the development and review of family education materials have been established and adapted from existing AHS and nutrition services tools. With regards to the enteral feeding family education materials, we took a very similar approach to reviewing the inventory of resources. And I want to acknowledge that there were so many thoughtful resources already in existence and in use. And these were thoroughly reviewed by members of the Equipment and Supplies enteral subgroup and their colleagues for adoption, adaption, and creation. And we were successful in adopting 5 family education videos developed by the Edmonton Home Nutrition Support Program team. Upon review of existing booklets, brochures, and handouts, we were able to adapt the information available into family-friendly tube-specific handouts that have a consistent look and feel. And where information was similar across the existing booklets, we were able to merge the content into one. Some information has been reformatted into more of an FAQ format. And at this time, many of these resources are in their final stages of content review and formatting. So for now, we have posted the original booklets. Family learner checklists to support consistent discharge teaching have been reviewed and adapted for provincial use. And as well, provider training checklists that were in existence, we've merged the content from both the programs into one. More recently, a new handbook and handout on home blended food for tube feeding has been developed by the Calgary Zone, and these are posted to the PEAS website as this was felt to fill a gap in the existing materials. Since our last presentation, we have actually reviewed these resources with provincial stakeholders and are in the final stages of review and formatting these for provincial use and for PEAS posting. Additional resources for families, such as key websites and pump operating manuals, are also posted to optimize the family experience and to access what they need. When we visit the website under the For Families tab, we also have a tube feeding section on the left-hand side. And within that, we have several drop-down options for families and providers where you can view the videos, the education materials, and any additional resources posted. All order forms and family education resources posted to the PEAS website have been endorsed by the Standardized Practice and Education Working Group and have also been presented to the PEAS Steering Committee. Resources can be printed directly from the website or ordered in bulk through data communications management or print services. And we've included instructions for each zone on the website for your convenience. As new forms and family education materials become available, they will be posted to the PEAS website and added to the data catalog. As part of the Standardized Practice and Education Working Group's overall education plan, we haven't forgotten about you, our beloved providers. When the working group met to discuss provider education, we really saw this as including 3 different strategies. The first strategy was to provide education that is foundational to practice. This foundation is built on the work of all the PEAS working groups, and it's how we came to plan today's presentation. We hope that by offering you an overview of the PEAS project and its deliverables, that you will have the knowledge and tools you need to support your pediatric eating, feeding, and swallowing practice. Secondly, we heard from clinicians across the province that both advanced practice and mentorship opportunities for those new to this area were needed. PEAS invites providers to connect with mentors to promote ongoing knowledge transfer and skill building. And this in turn enhances the quality and equity of pediatric care provincially. We envision this work will continue to grow and develop over time. And thirdly, PEAS has created a community of practice SharePoint site where we invite you to connect with and learn from each other. We hope that this community will grow and evolve organically over time with leadership from provincial practice leads and all health professionals. As you can see, the website offers a quick and easy access point for providers to access a wealth of resources. As professional development opportunities or resources are brought forward to the working group, they are reviewed according to some agreed upon criteria, which helps guide what we post for providers. The provider page also enables you to access the community of practice page. Once you head over to the community of practice web link, AHS providers can join the community and begin posting right away. Membership may be requested to the SharePoint administrator for providers that are external to AHS. We are really excited for you to join this conversation. I now welcome the Equipment and Supplies Working Group leads. Thanks.
Hi, I'm Mary O'Gorman. I'm a unit manager at the Alberta Children's Hospital for Unit 2, and I'm also the manager for the Home Enteral Nutrition Program. I'm also the co-chair of the Equipment and Supplies Working Group, along with Dr. Justine Turner and Heather Lissel. This next section focuses on the work completed by the Equipment and Supplies Working Group. And the working group was subdivided into 3 groups: our enteral feeding equipment and supplies, oral feeding, and funding accessibility. The aim of all the equipment and supplies working groups is to provincially align practices related to the selection, provision, and use of enteral and oral feeding equipment and supplies, to provide families with information to support successful feeding and positive feeding relationships with their children, to align practices with evidence-based information wherever possible, to facilitate information sharing amongst practitioners, and to provide families access to the same information as practitioners. In order to ensure all children with feeding tubes have access to what they need and to minimize overuse or waste, the Enteral Feeding and Supplies Working Group has developed supply guides for monthly orders. Supplies are categorized by both NG and G-tube quotas. Quotas have been aligned across both the Stollery and Alberta Children's Hospital's home enteral nutrition programs, and families who have been on the program for more than a year will see changes to the types and amounts of syringes, reduction in the types of creams, tapes, and dressings, reductions in the number of bags provided from 1 bag per day to 1 bag every 3 days, or roughly 10 bags per month. The PEAS Steering Committee decision to reduce the number of bags was based on information obtained between 2004 and 2019 in an evidence-informed rapid review. Bag reuse up to 72 hours was reported to be safe based on information from the National Clinical Guidelines Center of 2012 and was based on publications that were done across, other publications that had, other published Canadian guidelines. There are some children for whom 1 bag a day will still be provided, and these children include those who are immunocompromised, who are J-tube fed, are up to 6 months post-transplant of any type, whether heart, liver, kidney, bone marrow, or premature infants up to 4 months corrected age. In addition, the website has forms that families may use to order their supplies from either of the programs in Edmonton or Calgary. And for families who wish to purchase additional supplies, syringes, bags, backpacks, etc., there is a provincial list of vendors that carry Cardinal Health products. Families should call ahead to ensure the vendor has available product on hand. Also on the site, care providers and families can find a searchable equipment and supplies list. And this is intended to be a guide that clinicians can use in their discussions with families and a resource for families to do their own searches for supplies. The supply list can be filtered by developmental stage or category, and the search function can be used to look for what you need. Users also have the ability to email the item to themselves or others. Under the family resources in the section on tube feeding, you'll find videos that demonstrate insertion of a McKee G tube, a balloon gastrostomy tube, and an NG tube. There's also a great video listed, which is a resource for families and gives providers a glimpse into family life and coping with home feeding. Resources that support oral feeding include handouts on choosing the appropriate bottle nipple, high chair purchasing considerations, choosing a soother, modifying a high chair, and building a table for a booster seat. The bottle nipple handout guides users in selecting a nipple with the appropriate length and shape to support a good latch, plus how to select a nipple with the correct flow rate. The soother selection handout provides similar advice on choosing a soother with the correct shape to facilitate healthy sucking. The Modifying High Chairs handouts offers guidance to families on how to use common household items such as blankets to help them provide better support to a child while sitting in a high chair. All of these resources are available on the website and can be printed as well. Finally, if you or your families are looking for funding-related resources, this section on the site describes the various sources of funding. It includes brief descriptions of the various government-funded programs, such as the Family Supports for Children with Disabilities, and the Child Health Benefit, plus links to their websites.
Great. Thank you, Mary. Good afternoon. My name is Tricia Miller, located in South Zone, along with co-chairs Melanie Madison-Dewar in Calgary Zone and Vanessa Stanky, the Peace Project lead. We wanted to share a short spotlight on the rules and implementation work. As was mentioned earlier, stakeholders across the province identified collaboration and role clarity as the second most influential factor to providing quality care for children and families. So we worked with clinicians, families, HS, health profession strategy and practice, COACT, and colleges to develop a suite of tools related to collaborative practice and roles, which can be found on the PEAS website for providers and families. We also have much content and tools related to collaborative practice and roles, and we'll be presenting this as a separate topic as part of this learning series on November 5th. So please be sure to sign up or watch this learning session. Thanks so much.
Okay, so I'm going to present about the evaluation portion of our PEAS project on behalf of myself and my co-chair, Mark Milland from the Evaluation Committee. So as PEAS is a quality improvement initiative, we hope that families will experience improvements in the quality of care and health outcomes as we continue to roll out the project. One way to help us measure and focus on continuous quality improvement outcomes is through a short 5-minute survey that we have listed here on the PEAS website. This survey can also be provided to families in paper form or by email. Families would be invited to participate in the survey after each eating, feeding and swallowing visit. And we're working on a dashboard for providers to help report on overall outcomes that they can see for their own clinics. You can learn more about this in the quality improvement section of the PEAS website. So finally, you can contact us by email by using the PEAS contact form, which we're going to show you on the next slide on the website, or by the email above. And please feel free to suggest any additional tools or handouts that you would find useful, or to give us any other feedback. This is the contact form, right? Great. Okay. So please also consider subscribing to our news and events through the website. So I would like to thank all of the people that have been involved in this project, particularly the working group co-chairs and members. Vanessa Stanky, who's our project manager, and I know she's been answering a lot of people's questions in the chat room. We really couldn't do this work without her steering the ship. We also have a steering committee and leadership team that we want to recognise for their input. And very importantly, a number of family advisors have been involved in this project, even all the way through to the website production. So we'd be happy to take questions and comments. And the next slide. Oh, we're going to do questions next, Vanessa, is that right? So if you either want to, again, if you want to post them in the chat side or just put up your hand. I know there was one question from Tamara about whether, given that we're standardizing the approach to enteral nutrition across the province between Edmonton and the Calgary program, would patients be able to be transferred back to their home sites for tube feeding without having to have teaching at the separate site? That's, Heather, is that something you've discussed or?
And sorry, Justine, I was just having trouble finding my mute button.
No worries.
Thanks.
I'm just wondering if Heather had a response for that. I don't recall that being something we specifically discussed. It definitely is work in progress. I think the equipment and supplies are quite standardized now.
Oh, this one from Tamara?
Yep.
Okay, yeah.
That's probably a good question for Heather.
Yeah, or Mary.
Or Mary, yeah, sorry.
Yeah, I don't have anything to add to that. Mary, do you have a response to that?
I'm just, and maybe Tamara.
I mean, one thing I would say, I mean, it's very important for contact with both programs to be made, right? I mean, a part of the education occurs post-hospital discharge is critically important. So I don't think it's going to completely negate that aspect of needing to go and meet people in the program at your site, whether that's Calgary or the other way, whether you're coming to Edmonton. But a lot of the initial education approaches and the information giving will be quite standardized, if that helps.
And Tamara, if you want, I can take you off of mute if you would like. Just let me know. And for anyone else who has comments or questions, you can feel free to use the Q&A and we'll queue those up or type them into the chat and hopefully we'll see your comments here. Yes, okay, I will just go and find you and unmute you. And Heather, if you want to just have a quick look and see, or here, let me search for you.
There she is.
There, you should be able to talk now. And you might have to take yourself off mute.
Can you hear me?
Yes, we can.
I just wanted to clarify, because I know we have a lot of patients that come up here for cardiac surgery for the pediatric program, and sometimes they just are literally being transferred hospital to hospital for all the teaching to be done. So just to clarify, so could the teaching be done here and then them just go meet the team in Calgary as an outpatient? Is that now going to be a possibility, or is it still teaching all started there with the meet and greet there as an inpatient?
I don't think teaching necessarily would be the defining factor. It may depend on access to things like pumps and so forth. So, for example, not so much to Calgary. Maybe Mary can respond, but if you're going to a different provincial program, you're not going to be able to go with a pump. So those patients will end up having to meet the program to access their pump, for example. And a lot of those, the programs do prefer they go inpatient. But maybe Mary can comment on what we would do going between Edmonton and Calgary for those patients.
Mary, are you able to comment? Can you hear us? Oh, I think she's just having some mic trouble.
Sorry, can you hear me now?
Yeah,
there we go.
Sorry. So Tamara, no, I think the generally speaking, we haven't set up sort of if you're coming from say Red Deer or another center or whatever, we haven't set up the teaching to be done in those centers yet, but it would be something to be considered. I mean, some of the teaching is fairly standardized. I think as Dr. Turner commented, some of the pump specific teaching does probably need to be done by the separate programs in Calgary and Edmonton. So I'm not sure where specifically you are that you're asking about patients maybe coming from and whether teaching could be done in those different sites.
Tamara, did you have anything else you wanted to add there?
Can you hear me?
Yep.
Okay. So I work in pediatric cardiology at the Stollery, and we've always had to, basically all our patients that are from the south of Alberta have to go back to Alberta Children's for all their teaching, whether they require a pump or not. And that creates a lot of frustration from families because they're ready for discharge, but they can't get their teaching here. And it's not so much equipment. Many of them are more than willing to go there and pick up their equipment on the way back to their homes. And we have provided equipment here sometimes from the unit as like a short-term solution. So that's kind of more what I was getting at.
Yeah, I mean, I guess I would say the only thing is, and I don't know what the policy is, I should, but I don't, but there is an argument to be said for you need to contact the program is going to provide you post-discharge support. So if you have education here and then go to Calgary and you don't actually know who to contact, or you've never met them, you have no rapport with them, I mean, that's not ideal, right? That's not ideal in terms of ongoing support. So it's not like you teach patients and then they go in the community. It's an ongoing relationship. I hope that answers the question a bit better, Tamara.
It probably is something we can consider, and Tanis Bush and I, as managers of our programs, could certainly take that offline and have a discussion of whether that, because certainly the teaching of the actual insertion is, if we shouldn't have delayed, we shouldn't have to transfer them back just for that piece of teaching, but certainly connecting with the programs, as Dr. Turner had mentioned, would be important. But Tanis and I can take that offline. Good question.
And then I know Rebecca Allen asked about xanthan gum. I don't know, Vanessa, if you're able to show people the website and the CPG section on, so we can't really specifically answer your question, Rebecca, because I guess it is a peer question that you would be able to ask people on the website. But we can show you in the CPG, the section about thickeners, just to show you that there's some information there. And then there's also the possibility of going onto the website and posting questions.
Table 9.
Nice, Melissa.
Our baby.
Sorry,
table 9. That's right.
There we go.
Yeah. So with table 9, we've tried to include majority of the common thickeners that might be in use in practice, and tried to put together some evidence and information from their websites here. So if you do review it and find that there are any questions or gaps, we'd love to hear from you and provide that information. And I know there are some new thickeners potentially coming out on the market in the next year or so. And the plan would be to update this and maintain its currency. So, but as far as like details on gluten-free, low glycemic index, some of those aspects, we really couldn't include maybe every piece of information. The websites are constantly changing, and so that would truly be the source of truth on some of those details, but we have tried to include as much detail as we could, so some of them are identified as gluten-free when that information was available.
Yeah, and as Justine mentioned, people, that's great. Yeah, people are able to also post those types of questions to your colleagues in our community of practice. So if you want to join there, Rebecca, hopefully others will respond as to what they're using too. Awesome. Thank you. Heather, were there any other questions that you saw? Oh, yeah, that you saw pop up?
No, I'm just checking.
I didn't really see any, I think, because you answered some during the presentation, Vanessa.
Yeah. And if anyone wants to put up their hand to unmute, I can unmute you as well if it's easier.
It's Melissa. There was a question regarding some of the nutrition service handouts, and I did put a reply there, but I guess just as follow-up, when we did the resource review, we really tried to be selective and not include every single handout, from nutrition services as an example that we might use in practice. We tried to target those that might be more commonly used with a pediatric feeding disorder, or with a patient who has a pediatric feeding disorder. So you're not going to necessarily find all specific therapeutic diet information there. You'll find the texture modified diets, but like a low sodium diet handout, for example, won't be posted there. Those are still available on the external ahs.ca nutrition education resource page. And then as well internally to AHS, we have some additional resources that may not be posted there. So just depending on the need, you're welcome to contact me directly.
And then Vanessa, there was a question from Rebecca about if you had to be a part of AHS to join the community of practice.
No, you don't. It is open to external healthcare providers. We just require that like we have an administrator who would admit you to the community of practice.
Yeah, and I've just pulled it up here, Rebecca. So when you go to Community of Practice to join, I've just linked it here. So you have to be someone with an AHS account, which we can get you, but just click here and you'll see in the notes, just email us with this information. It takes us a little bit of time to get you that account, but once you're in, you're in.
Okay. All right, so we might as well, we'll finish off, seeing as I think we've addressed most questions, and you can certainly email us afterwards. There's just one more slide.
Oops. Oh, sorry. I keep losing the slide.
No, that's okay.
Go ahead.
So this is just to say thank you for attending today and your participation and interest. We would be really grateful if you would consider to complete our 5-minute survey. The link is shown up on the slide. And that's just for your feedback for these virtual training sessions and for the website itself. And that's it. Thank you very much, everybody, for participating.
Fabulous. Great stuff. I am going to stay on the line for a little bit just in case any other questions come in and just close up the webinar.
Okay, thank you.
Thanks,
Vanessa.
Justine.
Thanks, everybody. Great job.
Thanks. Yeah,
Bye-bye.
good job, you guys.
I see another question on there. What would you want local, rural, central zone partners to provide?
Oh.
I'm not sure if Daralee is still on the line.
I think, yeah, it looks like she is. Oh, and now she's off. I think. Oh no, she's there. Daralee, I'll just navigate over to, what do you think, Melissa? I was thinking about the standardized service document. Is that what you were thinking too?
I'm not sure what the question is around providing. Is
Yeah.
it service or resources or?
That's true. Daralee, do you want to come off mute? I can allow you to talk, or you can type if you want. Sure, Jacinda, I was just about to email the survey link, but let me put it in the chat while we're at it too. Oh, I think Daralee is.
Okay. Can you hear me now?
Oh, there, now we got you. Yeah.
So much of the discussion was about different services in Calgary and Edmonton, and I'm just wondering, obviously with us attending these PEAS seminars, you're wanting some interaction from the central zone. What is the expectation or their hope that central zone partners can provide?
Like in terms of the clinical services for children with feeding and swallowing disorders?
Yeah, like I can see some of the stuff would be good information to share with families, but as far as I know at the beginning, they said something about, well, you are the providers and we would hope you'd be able to do these things. And I'm just going, so I'm supposed to be a provider of the service?
Melissa, do you want to tackle that a bit or tease out a little more?
It's really more of like a service access question, but I mean, we have as part of the project, and you'll find some more information on the website, shared some information on what would be maybe provided at a local level, a zone level, and a provincial level in terms of service delivery. And so sometimes that service might not exist at a local level. And so then you might be looking towards the zone for direction on where that service might be provided. And in some cases, you know, the enteral feeding programs, those are primarily located at that provincial level where the hub is in Edmonton and Calgary. But at a local or a zone level, there might be some element of service where they're collaborating with that provincial group. So again, it might just depend on what specifically you're looking at. And that standardized service document, yes, Vanessa, I think that would be probably helpful.
Yeah, okay.
To navigate to as well. I don't know if Neil is on the line still, but
This is Beverly.
oh, Beverly.
Beverly, what a great question. Hi, I'm Melissa's co-chair for Standardized Practice and Education. I think that we would also encourage you to go to your leadership team who are working collaboratively with PEAS to develop learning, Vanessa, ILIs, what?
Oh, ILCs, the Innovation Learning Collaboratives. Yeah.
Innovation Learning Collaboratives. I think you would find that they would provide a great source of information about how teams can be built and developed in all across Alberta.
Okay, so that is something that might be a possibility, but that doesn't seem, it's not necessarily an expectation that each area can offer those level of services.
I think what's so remarkable about PEAS is it provides, I guess, sort of a platform to build a landscape in the different zones in across the province. Recognizing that we have representatives from all zones who are tremendously committed to this work. Would you be able to identify a leader from Central Zone, Jacinda?
I think Darilee, you mean, is that who you're referring to? Is just who in the organization she would connect through from an administration perspective?
Yeah.
Yeah.
Well, my manager is Tom Hope.
Yeah.
But
oh, Tom.
That's good. Yeah.
I'm from Central Zone, Darilee. I've worked in Central Zone for 13 years and only the last 2 in my current role. So I think that's a great follow-up conversation to have with him. Tom is certainly apprised of this work and could definitely be a great resource for you.
Yeah, it seemed like they have asked us all to attend these 3 seminars, which is awesome, but I'm just not sure what's supposed to happen after that.
Yeah, and that's why I think it's, you know, we're trying to get the word out, share the information, share what's available, identify where there have been gaps and where we're just really starting to bridge some of those gaps. And so as far as expectations go, I think that really comes back to Beverly's comment, connecting with your leadership and having that follow-up conversation like, wow, this was a lot of information today and this is what I took from it and these are the questions I'm left with. Right. And I think he'll be able to guide you there.
And do you know how it goes? Like so far, we've had any feeding concerns. The occupational therapy really has been more involved with that, unless it was an adult needing swallowing assessment kind of thing. So are you seeing speech as becoming more involved, or what are you thinking?
Yeah, so
I would encourage you, I think you're a speech language pathologist, aren't you?
I am, yes.
Yeah, I would encourage you to connect with your professional practice lead in Central Zone. Absolutely, as part of an interprofessional team, speech language pathologists provide a unique skill, as do occupational therapists, psychologists, registered dietitians. We all have something very important to contribute to a child's care. I know that our professional practice lead, Julie Evans, is tremendously committed to the PEAS work. Would your professional practice lead be Denise Sorensen or Crystal Kloss?
It's actually May Picardo.
May Picardo.
yeah, and she's also, I think she's attended some of our info sessions for practice leads as well. Yeah. And so Darilee, I would also recommend we have the collaborative practice and roles session coming up where we delve into that a little more. And really, as you can tell, a lot of our tools here are adaptable, and it kind of depends on the, what each zone has in terms of capacity and yeah, capability. And so that's why we're saying go to your local leader, and then they'll kind of work through what that looks like for your team. But we're also inviting managers to send staff to our innovation learning collaboratives, where it's going to be more hands-on, and we're going to talk about how to actually implement the clinical pathway with you and walk through that process together with you.
Okay. Yeah. Okay. So the first step is to go to my management and see what how they want to apply this to rubber meets the road.
Yeah. Yeah.
Okay.
And I've just pulled up this document here. It's actually not published yet, but I think it's literally just waiting in the wings to get put onto the website. But this is where we've tried to identify local, zone, and provincial. And so some of the expectations, and some of them are stretch goals for sure, but this is where we're heading towards.
That's a good name for it, stretch goals. I like that.
For sure. Yeah, and for sure you'll find in many zones, OT, SLP, RD, RN, physician, they work together in a collaborative team, and that's something that we're really trying to promote through PEAS. So you'll find that in our collaborative practice session.
Okay.
Stretch goals.
Stretch goals.
It's like going to be my new, I'm going to steal that. Yeah, great one.
Well, it's not mine, but yes, feel free. Awesome. Such good questions. I will see on the line.
Sorry. So at some point, if I go on the PEAS website, that information would be there, that one that
this
you just
document.
were showing.
Yes. Yeah. And if it's not here, it's definitely going to be on Insight. It's just working through its way through health profession strategy and practice. There's a number of documents like this that they're posting all at the same time. So one way or another, I will post a link to where it's located through the PEAS website.
Awesome.
Yeah.
Okay.
Great questions.
Thank you so much.
Yep. A little bit of bonus time at the end here.
Exactly.
Are there any other bonus questions people would like to ask? I see there's just a few other people on the line. You're welcome to ask them.